The World Health Organization is hoping to ramp up the fight against H1N1 flu virus worldwide. The WHO hopes to begin shipping 60 million doses of vaccine to poor countries. The primary target is healthcare workers. Health officials say that by developing countries actually risk being overwhelmed as doctors and nurses get sick and they won't be able to care for the patients. Medical personnel in West Michigan are starting to get their shots. Healthcare workers in Muskegon County are set to get their shots around midday tomorrow. Meantime, employers, schools, and hospitals are working on plans to handle flu outbreak while keeping up with day-to-day business. Some of them got a few ideas from an international emergency expert. Carolyn Wiley has a story from Kalamazoo.
They're talking about things like social distancing. For example, is there a plan in place to create at least 6 feet of space between workers if the virus seems to be spreading around an office? It's a worry shared by many who share space. Will one case of the H1N1 virus lead to a major upset of business?
If they haven't done much planning in advance, they're going to be probably a little bit behind the 8 ball.
Regina Phelps helps organizations come up with a plan before trouble strikes. Today, about 150 businesses, schools, and health providers showed up to hear what Phelps had to say, covering everything from workplace hygiene to sick time policies.
Here in a depressed economy, where people are fearful of losing their job, people are very likely to come to work anyway if they're sick. So employers really need to work with their HR departments and maybe even their legal department to how they can support employees if they're sick to stay home.
And what one organization does can affect another. It could start with an outbreak at a school.
That starts to impact your employees. I mean, they've got to obviously stay home to take care of their children. So what we're trying to do is say, okay, how can we operate as a business if we begin to have a reduction in staff? So one of the biggest things is, do you have the capability to work from home?
Jim Goebel is an incident manager for National City PNC. He says the company's had a pandemic plan in place for 3 years and distributes H1N1 information to employees through its employee website.
The key to this is really having an organized group of people that you can bring together that really start to get all the right people in the organization organized.
For organizations who would like quick reference of action steps to take, the Centers for Disease Control has some of the basics on its website. That's linked to our site at wwmt.com. In Kalamazoo, Carolyn Wiley, News Channel 3.